So this is the spectrum of obesity, and you can see from the level of invasiveness, okay, to the efficacy, we had a gap between the lifetime intervention and bariatric surgery. We have been using intragastric balloon and endosleeve liner, but also we've been operating only in this zone from 5 to 10% of total body weight loss. But with the remodeling gastric endoscopic procedure, it will enhance and magnify the durability of the weight loss and mechanism. Therefore, we will, in order to operate in this zone, while we are maintaining the safety that's provided by endosleeve gastroplasty. Currently, we have two gastric remodeling techniques. The first technique, we have endosleeve gastroplasty, and we have post-2 procedure. Endosleeve gastroplasty, we are using full thickness device suturing extended from incisura up to the fundus, resulting in decreasing longitudinal axis of the greater curvature, beside resulting in tubular shape of the stomach. While post-2, we are using certain plication. Each plication reduced the stomach by 7 centimeters, and usually we are using it in certain pattern from the incisura up to the fundus, resulting in shortening of the stomach and delaying gastric emptying. We can see here in this image that MRI image, we can see shortening the longitudinal axis of the greater curvature beside tubulization of the gastric volume. So we can conclude that in endosleeve gastroplasty procedure, we can preserve the function of the organ in terms of both innervation and vascularity. We'll talk about the real life and evidence base. We have evidence is mature and according in real life and in randomized controlled trials. I can share with you here the meta-analysis which has been published a couple of years back, where they enrolled more than 1,700 of patients. And we can see that from the data, it's heterogeneous, and the data most probably getting the same result by total body weight loss at 12 months, 17% of total body weight loss, with 2% of side effects only, which most of the time managed endoscopically without need of surgical interference or ICU management. Same data already also we got from Brazilian consensus on endoscopic sleeve gastroplasty. And in this study, they enrolled more than 1,800 patients. And these patients, they reached by the end of 12 weeks, 18% of total body weight loss with minimal side effect, about 0.8%, which was managed endoscopically as well. A part of the better or the improvement in the general lifestyle for patients with the obesity, also we have metabolic effect. And this is what we discussed and published presenting during DDW, where where we evaluate the improvement in the hepatic steatosis, obesity, and insulin resistant in adults with non-alcoholic fatty liver disease who underwent post-2 procedure. The procedure resulted from prospective control pragmatic study. This is animation of post-2 procedure. You can see here we are inserting the transporter, and through the transporter we are helix grasping tissue, and the distance of the tissue which was grasped is about 7 centimeters, resulting in shortening the length of the stomach. And this plication is extended from the incisura up to the fundus, resulting in shortening the long axis of the stomach and causing tubulization of the stomach as shown here. In our study, subjects were recruited in Ministry of Health, Ubaydallah Hospital, Ras Al Khaimah, 40 patients and 42 patients. And these 42 patients were self-allocated in each arm, 20 patients allocated in post-2 procedure beside lifestyle modification, and 20 patients self-allocated also in life modification alone. And all of these were arranged in one-to-one fashion. All the patients at the study initiation, 6 months and 12 months, they were having questionnaire, obesity questionnaire, and the difficulty of weight. And also a fibroscan was performed for this patient, including liver profile and lipid profile, insulin resistant, and hemoglobin A1C. We can see here the result after 12 months. There is significant result for the weight loss for patient who's having post-2 procedure with the lifestyle modification. More than 10% they achieve 74% of patients achieve more than 10% of total body weight loss. Also, one of the endpoint for the study was showing the improvement in the CAB change, and there was significant CAB change at 6 months and significantly decreased also to reach below the threshold, published threshold of fatty liver, which was 222 by 12 months. Also, we can see also one of the targets we achieved for this study, that most of the patients, which are about 53%, reach S0 at the end of the study, comparison to 0% with who were in the lifestyle arm alone. So from this study, we concluded that the post-2 procedure was effective for non-alcoholic fatty liver disease, and it was safe procedure, scalable, acceptable by patient, anatomy sparing. Second advance, we'll talk about also the combination therapy with the endoscopic procedure. The combination of endosleeve gastroplasty and medication like GLP-1 agonist. This is randomized controlled trial, which has been presented during DDW, and this by Hoff and group, where they randomized, allocate 61 patients who performed endosleeve gastroplasty, and they, after 1 month, they allocate this group divided in two groups. One group was on placebo alone, and the other group was on semaglutide or Ozempic. And after 12 months, they found that the patients who were on placebo, they reached 18% of total body weight loss, while the patient who's received Ozempic or semaglutide, they achieved 25% of total body weight loss, which is equal to bariatric result of losing weight. Also, we can't deny that we are concerning about the durability of the endoscopic procedure. Therefore, there is a new remodeling technique with enhanced durability. Here, there is modification for endosleeve gastroplasty, a novel endoscopic submucosal resection, enhanced endoluminal suturing for obesity, which has been published in Gastroenterology 2021. And what the idea behind that, they are exposing the submucosa muscularis, and they approximate the exposed muscularis to enhance the durability of the procedure. So they are exposing the submuscularis, and in between they applying ABC. Well, then they apply the suturing between these exposed area, avoiding that muscularis area exposed to avoid perforation. And they found that it's enhance the durability of the procedure. A part of thinking about how enhance and the procedure and the efficacy of the procedure. Also, this is a new technique. I'm happy to share it with you. It's post-2 enfolding modification, which is I started during my phase 1 study in the 3 months back. This is on the right side. We can see on the left side, we can see there is the classical post-2 procedure, while we are utilizing between 18 to 20 applications in this pattern all over the stomach. And in this pattern, we can know that we can't may play or obliterate the option of gastroplasty, gastrosleeve for the patient if the patient not achieving the weight loss. While the new technique, we are applying only 7 to 8 applications, and we are taking the longitudinal axis for the greater curvature, resulting in a tubular shape of the stomach and having satisfied obtained tubular shape, also we evaluate the gastric emptying, and we found that it's delayed gastric emptying in this patient. This is one of the case video. So this is the procedure. In this procedure, post-2 procedure, I'm using 2 helix, one of them in the posterior wall and the ending by anterior wall, grasping good volume of tissue, and after that applying the basket and cinching. I will show you here how it's Okay, I want to this is video. So we can see here the first line, second line for each application, and each application is supporting each line. I will make it fast. Okay. Anyway, we are resulting in tubular shape. I think no. We are resulting in tubular shape, and now here I can show you also. This is the upper GI study done for this patient, and we found that there is. We can see upper contrast. We can see in this study that it's similar, similar to the sleeve gastrectomy shape. So I think that maybe it's a promising procedure. Still, working. The initial data is promising, but we are concerning the difference between post-enfolded one and post-2. There is 2 different main different. One of them that it's we are using less plications, and this less plication about 7 to 8 plication, while we are doing in the regular post-2 more than 20 plication. Besides that, we are preserving the stomach in case that the patient failed in weight loss and he's planning to do sleeve gastrectomy. We'll come across now a novel procedure and energy modalities. Here, this is a promising also procedure, and this is a procedure, automated procedure invented by 90 Nodes company. And this procedure is a very simple procedure. They are inserting the device with the baby scope into the stomach, and while it's there, they start to open and pull on the vacuum while they are removing the gastroscopy. And while they are removing the gastroscopy, they are pushing the bottom to initiate the spiral suturing, which will involve the full layers of the stomach. This is, we can see, this is the internal tight application, suture a big stomach, and this is external aspect of gastric cavity in big stomach. The initial data is promising, but still we need more study for this suture. A small bowel, endoscopic bariatric metabolic therapy innovation. As we know that there is increasing diabetes and fatty liver, especially in our region. And as we know that duodenum is the second brain, or we can say it's the center of metabolic signaling. So therefore, we have a lot of modalities which has been invented because we are trying to regenerate the cells in the duodenum. We know that in metabolic disease there is insulin resistant, and we want to regenerate these cells by using different modules. In the market there is a lot of modules like water, heat, there is a lot of electricity, there is a lot of module has been used, but all of these, there is thermal effect. Beside that, we need to elevate the mucosa. Endogenic, this is a new company, invented a new technique, which is, I think, it's promising. This technique started in 3 countries, but still waiting for the FDA approval for this technique. They are inserting gastroscopy until the duodenum, and while it's there in the duodenum, they are transporting nano electricity, which penetrate the mucosa submucolaris and also enter-reach the internal nervous system, and these can regenerate the cells there and improve the sensitivity of the second part of the duodenum. Initial data for this device is promising, and it's under FDA approval. So by that, I'm concluding my presentation. The GI tract in front and central in weight and metabolic regulation. Endoscopic bariatric metabolic therapy will have a major role in management of obesity and metabolic disease. Future is bright with multiple innovation in the pipeline. Thank you so much.
Okay. Thank you, Professor Maryam, for this very elegant presentation. So we have the time for 1 or 2 questions. Yes. So we have question. Yes, please.
Maryam, excellent. You are always astonishing.
Thank you so much.
So why you decide to do 20 stitches? The previous one, endoscopy sleeve, gastroplasty, 6 is good. It looks okay. 20% body weight loss, I'm happy. Why you increase it to, and even if they can use Ozempic for a year or so, then that's enough. Why you put the 21, the other sleeve, the number 2, 20 stitches?
No, this is another, no.
Why you do the other one? The first one
No,
is
this
good.
is the first study which has been published and presented during DDW. It was using the old-fashioned, the current fashion of post-2 procedure. The new fashion, what I'm talking about, it's invented 3 months back in our department in collaboration with Mayo Clinic, and still under publication. So still, I said it will be a good opportunity to announce about it in Kuwait Society.
More weight loss.
More weight loss.
Okay.
Dr. Maryam, I have a question. So first of all, thank you for this great presentation. As a gastroenterologist, that you are dealing with many of these type of cases, and you dealt with different type of procedures, endoscopic procedures. Where do you see a GI endoscopy in the future? Keep in mind that we have lots of medication right now is available. Their successful rate is about 20%, 20% of weight reduction, and cheaper, much safer. Where do you see it?
It's a very nice question, Doctor. First of all, I'm running now a study, and this study we are having 2 arms for this study, post-2 patient. I have 25 post-2 patients. I have 20 randomized control trial and 25 patients who started on liraglutide or Saxenda. And actually, you know that to say that the drug is succeed or not for this patient, we need to achieve 5% of total body weight loss, at least during the 12 weeks from the starting the medication. So some patients, okay, they are doing well. Some patients, they are not tolerating the side effect. Some patients, we have a lot of varieties of patients, and most of patients, we have to keep in our mind something, that whatever we have in medication, it's spontaneous hormonal effect. So it's hormone. They are under hormonal effect. But do they really use it just to support them to change their lifestyle, or they want it just for certain occasion? They want it because they are traveling. They want it because they want to change their look. I think the concept of the obesity, we need to educate the people about it. It's a chronic disease, it's diabetes, it's hypertension. Once you will be treating the obesity, that you will delay the exposure for diabetes and hypertension at least 10 years. All of these things should educate the patient rather than the look. Most of my patients, when they are coming and say, "Doctor, we want to lose weight," I say, "Guys, we don't have to be same. It's good to have varieties. You can be chubby, you can be beautiful. It's nothing to do with your beauty. But the concept of the obesity by itself, it needs to be corrected."
Okay, thank you. So I think there is one more
One
question
more question,
there.
yes.
Thank you very much for this excellent presentation. I'm just asking about the role of these endoscopic procedures in recurrence of obesity on those who have done sleeve procedure before.
Actually, there is published data. I was part of this data. We use this as a revisional endosleeve gastroplasty for patients who gain weight post-gastric sleeve. And usually they don't need that much of sutures, maybe 2 or 3. But first of all, we need to make sure that either by doing gastric study, upper GI study, or gastroscopy to make sure there is dilatation in the stomach before performing this procedure.
Just one comment. With a small one. Very impressive from S3 to S1. That was very impressive.
Thank you.
So your procedure is to prevent cirrhosis, to prevent fatty liver. Excellent.
Thank you so much.